Are you struggling with knee pain and wondering what you can do about it? You probably have already been to the doctor and the doctor's either told you that you need to rest, or you need to take pain medication, or you need to stop doing certain activities, or worse yet, that you need surgery, and that's the only way to deal with this knee pain. But you just have a sense that you're not ready for surgery yet, and there should be things that you can do right now in order to help your knee pain and eliminate it so you can get back to the activities you love. Well, then today's video is for you, because we are going to be talking today about the 5 most common causes of knee pain and what you should be doing about it. The first common cause of knee pain is compensations in the body. Our bodies are designed to move us forward to do the things that we want to do. However, it doesn't always do it with the correct way. Remember, movement is life, so we should be able to move correctly, which allows every tissue in our body to heal. However, if we determine that we are going to move forward, our body is going to as well. So we create these compensation patterns, and over time they can cause wear and tear on certain joints or certain tissues that can lead to problems. And so usually this will start in your 20s. You'll start to notice that you have a little tightness or a little bit of a problem, and by the time you get into your 30s, it's a little bit more. Maybe it's limiting a couple of activities, but then again in your 30s you're busy, so you don't notice it as much because you don't have as much time for those activities, which goes into your 40s, and then you're busy working and doing all those things and not necessarily doing all the activities you love with the frequency that you used to do. And that's what leads you into your 50s and 60s and 70s, where you find yourself in retirement not able to do the activities you love. So your body will compensate in order to move your body forward, but eventually that can cause problems and wear and tear on the joints. So it's important to find, if you have knee pain, where is the compensation in your body that's created this problem in the first place. Common cause number 2. Is it that my hips are weak? Chances are pretty good that yes, if you are struggling with knee pain, your hips are weak, but it's important to get tested to figure out if this is a problem for you. The reason why we commonly see weak hips in association with knee pain is because many of the big muscles of the hip attach down into the knee. And of course, let's not forget about that pesky little iliotibial band that runs down the side of the leg. It's attached to the gluteus medius, which is a big muscle that's supposed to help stabilize our pelvis. However, if it's not working correctly, the IT band gets tight, and then the IT band pulls on the knee, which causes abnormal compression and compensations. Common cause number 1. So therefore, it's important to be tested so you know if you have weakness in your hips, so you know what to be addressing. Common cause number 3 is poor posture. Your body is designed to be able to stack. So your hips stack over your feet, and your spine stacks over your hips, so your head can fit on top. And all of this should happen with very little muscle activation needed. Everything should just be in the right spot, and so it's able to stack easily. However, if we have weakness, particularly in the abdominals, what happens is it causes our knees to bend just a little bit. So when we're trying to stand for a prolonged period of time, we could be paddle boarding, we could be running, we could be hiking. Whenever we're doing any activity, if our abdominals are not engaging properly, it's going to cause there to be a slight bend in our knee. Now, if our knee is not able to fully straighten, then it's not able to get the full movement it needs, and it can actually start to build up some arthritis to try to help, quote unquote, protect or stabilize that area. This is not what we want. We want to make sure that when you're standing up straight, everything is stacked correctly to decrease the force through your knees. Common cause number 4 is never fixing the first injury. So many patients I see who are in their 30s, 40s, and 50s and beyond with knee pain had pain as a child. So either they were playing sports, or they were just kind of clumsy and fell on their knees a bunch, or something like that happened, and they never bothered to fix the original injury. See, there's a lot of things we can get away with when we're younger because our bodies are just more nimble and heal quicker, but that doesn't necessarily mean that that healing is going to be complete. It could be that that healing causes scar tissue, the scar tissue causes abnormal movement, which causes abnormal compensations, which leads to pain and degeneration in the joints over time. So it is really, really important, and I always tell my young people this, it is really important to fully fix this injury, not just eliminate the pain, because eliminating the pain is actually the easy part. We need the tissue to fully heal in order to not have this problem affecting you in years to come. And common cause number 5 is a lack of stability. So it is very, very important that the small muscles, particularly around your knee, your ankle, and your foot, as well as the ligaments, have a normal tone to allow for the stability. Or else when you're walking, running, hiking, doing any of those activities, you're having that abnormal wear and tear on your knee. It is really, really important to make sure that you've got good balance, you've got good proprioception, so that's the body's awareness of where it is in space, so that you're not causing microtrauma while you're doing these higher level activities. Because the microtrauma over time will lead to injury or lead to arthritis or lead to other problems that eventually will cause pain. I have a lot of people who come into the clinic who say, my doctor took x-rays, they saw arthritis in my knee, and they said I have to have a knee replacement. Now, I will tell you, more often than not, if these patients had both knees x-rayed, the one that the doctor wants to replace is actually the one that has less arthritis. Because you see, the doctor wants to replace the knee that is the most painful, which that makes sense. But often that's the one with the least amount of arthritis. Now, the reasons why that's true are a little bit beyond the scope of this video, but I want you to know it may not be your arthritis that is actually causing your pain. I've seen it time and time again, and luckily patients are starting to become really wise to this because it doesn't make sense to them either. Now, can I stop arthritis progression? Yes. Can I heal arthritis that's already formed? No. Arthritis that's already formed is an abnormal bony formation, and there is nothing that we can do to change that. So yes, I do understand you have to have surgery to completely eliminate the arthritis. You would have to have a new joint put in order to get rid of the arthritis. However, we can stop the progression of the arthritis, which can also eliminate your pain and get you back to the activities you love. And a lot of that starts with getting more stability through the knee while you're doing the activities so that you have less formation of arthritis. That helps to improve the movement, which allows all the other tissues to heal correctly. So there you have it, the 5 common causes of knee pain that your doctor probably has not told you. Now, if you have been told that you need to have a total knee replacement, I'm going to encourage you to watch this video over here because it has some great information, some things for you to think about before you sign up for that surgery. Have a great day, everyone.